Dr. Mehu. Can I share my screen? And thank you for Dr. Ashok also for inviting me in a wonderful meeting. Today, I would like to share with yours with the 10-year study of pediatric ophthalmic trauma in Jakarta Tertiary Eye Hospital. As we know, the ocular trauma is a non-congenital monocular blindness in children, which is usually accidental, but most of preventable. And in 2010, there was a 2.4 million ocular trauma in US each year. In children, they have 35%. And in study in China, more than 54% patient with the open globe injury and 38 patient with a closed globe injury. And the study in UK, they have a 60% open globe injury and 30% in eyelid trauma in children. As we know, initial assessment in children is challenging due to the unreliable reporting variable history and poor cooperation during the examination. Monocular injury in children also have an added complication of amblyopia, which is make a management more challenging. This is our 10-year study, retrospective cohort study in patient. We conduct in the medical record collection. There was 194 patients with the 201 eyes included. We divided into closed globe injury, open globe injury, adnexal, orbital fracture, chemical, and firework injury. The result from the 194 patients, the mean age is 8.6 years old, with the ratio boys 2 times than a girl. And we can see in here more of the range of the age. Majority was a boy, and if we can see in the demographic data, the majority is the closed globe injury, and second is the adnexal injury with 33% case. We can see boys experience more injury than the girls, or all the type injury except in a chemical injury. The girls have more than the boys. But I think in this study is similar with UK, Egypt, and China. The closed globe injury and adnexal have a most common type of injury. And in our study, more of them they don't have. We don't have a recorded of the place of injury, but more than 21% had injury at home, and 5% related to the sport injury. And I think this study is similar in the Egypt and China study, where the home have had in the children have more common place injury in children at home. If you look the type of injury in characteristic, in the closed globe injury, the majority was subconjunctival hemorrhage, hyphema, and retinal commotio. But the second one is adnexal injury. The most common was upper brow hematome. And the second was the partial sickness, and then the laceration with and without canalicular involvement. And the third is open globe injury. There was a corneal rupture was most common. And then the second in the iris prolapse and traumatic cataract. In chemical injury, the abrasion cornea was common, and the firework, there was a hyphema, more common, and we have a 3 patient with the orbital fracture with conjunction with traumatic optic neuropathy. In zone involvement, according to Beth's study, we comparing about the zone 1 and zone 2. They have a statistical significant, most common injury in children if we comparing in zone 1 and zone 3 also. And in here we can see the closed globe and open globe injury is most common had in the zone 1 according to BETT study. For the management, we can see in here the medication is more management. We have more common because, as we know, the cause in our study they have subconjunctival hemorrhage and the hematoma purpura. We have 16% surgery, and the most common in open globe injury, about 44% patient. And the second is the adnexal with and without canalicular involvement. And we can see in here, in visual outcome, the graphics, we can see regardless the open globe injury patient underwent surgery for most cases, and the final result was better more than 4 to 25%. In figure 3, in here we can see the correlation between the initial and final visual acuity based on the gender. The poor visual acuity outcome we can see in here in a boy had a more poor prognosis visual acuity. And then for the figure 4, we can see in here the correlation between the initial and final base of the type of injury. Open globe injury represented have poor visual acuity. And using the Spearman correlation, we found strong correlation between the initial and the final visual acuity with the p-value less than 0.001. And if we're comparing with in our study, in 27 patients have a recent moderate and severe visual impairment and blindness as their visual outcome. While I think a little bit similar with the in UK in 29% case. And the case with poor prognosis in cases with the macular hole, retinal commotion, and orbital fracture caused by accident in bicycle. And the second one is a blunt trauma caused by the wound. They have retinal detachment and the traumatic optic neuropathy. And we can see in here, if we analyze with the ocular trauma score or pediatric ocular trauma score parameter to predict the visual outcome, as we can see with the OTS parameter, including the initial visual acuity and globe rupture, have a significantly statistical thing, a little bit different with another study with Socorro et al. They have reported the initial visual acuity and retinal detachment. In our study, the retinal detachment is only in 2 cases. And then if we calculate with the statistical, it's not significant for correlation with the final visual outcome. With the parameter pediatric ocular trauma score, they have another parameter, but when we have we're trying to calculate the initial visual acuity, iris prolapse, organic or unclean wound, delay the surgery more than 48 hours, and traumatic cataract. They have statistically significant to predict the final visual outcome. I think this similar study with the Zuckerberg et al. For take-home message, open globe injury result in the long-term visual impairment to blindness in pediatric population. Both OTS and pediatric ocular trauma score are highly predictive prognosis tool for closed and open globe injury in pediatric. Last but not least, it is important to encourage parents or other family members to establish a safe environment at home and to educate the arise parental awareness about the care seeking the treatment after the injury occurred. Thank you for your attention.